Good afternoon, everyone, and I'd like to welcome you to the next session that is part of our AIDSWatch effort today. The session that we're going to be talking about today is focused on HIV and racial justice and decentralizing whiteness and centering communities of color. My name is Valerie Rochester, and I'm Vice President for Program Strategy at AIDS United, and I'm happy to be the moderator for today. And I'd first like to acknowledge that I am speaking to you today from my home in Laurel, Maryland, and that I am on occupied Piscataway, Conoy, and Anacostan land. I'd also like to acknowledge the fact that these are really trying times that we're living in today, both from the COVID-19 standpoint and also from the resurgence of racial injustices that we're seeing on a daily basis and experiencing. And the challenges have been particularly difficult on both fronts for people in Black and Brown communities. And the impact of these dual pandemics on top of HIV and the effect of these on communities of color has just been undeniable. So that's one of the things we're going to be talking about today. I would finally like to acknowledge the ancestors that came before me, and for me having this opportunity to be here today and speak with you on behalf of those ancestors who paved the way and led the way and made it possible for me to be in this position today and speak with you today. With that, we're going to be talking with several experts in the field and presenters that have a really solid perspective on the impact that the dual pandemics of COVID-19, HIV, and racial injustices have had on communities of color. And I'll be introducing them in just one moment, but I think that's one of the things that is going to be most important about this discussion, because we really have been experiencing this tremendously in Black and Brown communities, and the fact that we have this opportunity to talk with several wonderful women today who will be able to share not only the perspective from a lived experience and personal standpoint, but also from what they have seen and heard from the various communities that they're representing. And each of our speakers today has a unique perspective on a particular community that is experiencing these challenges today. And we look forward to hearing from each of them. We're going to be taking about 10 minutes each for each of our presenters to speak on the particular area of focus that they'd like to choose as it relates to the impact on their communities. And following that, we will have an opportunity for questions and answers from the audience. I would also like to mention that we do have American Sign Language and Spanish interpretation available for those who need it. And we will also be utilizing the chat feature and the Q&A box for questions that will be coming from the audience. So with that, let's start our session. And again, it's HIV and racial justice, decentralizing whiteness, and centering communities of color. Today we have with us Vanita Ray. Vanita is the Deputy Director for the Positive Women's Network USA, and we're happy to have Vanita with us. We also have Araya Lester, and Araya is the Deputy Director of the Transgender Strategy Center. Hello, Araya. We have Ana Duarte, and Ana is Health Policy Associate with Southern AIDS Coalition. So welcome, Ana. And then finally, we have Rania Copeland, and Rania is President and CEO of the Black AIDS Institute. And as each of our speakers comes to you, I will ask them to provide a little more about themselves. I just gave a quick introduction by way of name and affiliation, but anything they would like to share, and then of course sharing their perspective on the impact of COVID-19, racial injustice, the intersection of that with HIV on communities of color. So I'd like to start off then with Vanita. Vanita, welcome.
Thank you, Valerie. You look gorgeous. Thank you all for having me. I feel extremely honored to be among this list of women that I greatly admire. I'll just share just a brief, a little bit. I come to you from the perspective of a woman living with HIV, diagnosed 17 years ago while a practicing attorney in the District of Columbia. Totally shook my world and did not think I wanted to live, be a woman living with HIV in this world. And because of, I think, HIV advocacy and some of the other injustices I've seen, it's become a personal and professional passion that's allowed me to continue to do the work and continue to serve community. One of the things I had to discover not long after my diagnosis, I'm a mother, I'm a grandmother and all this. How do you talk to your grandson about your grandmother lives with HIV and what that means? How do I talk to my grandson about what DWB means? He's 16 with a license, right? You know, HIV and racism. One of the first things that I discovered about this was that of all of the women living with HIV, 60% of them are Black women. And why is that? And I started asking that question, and I would hear answers that I'm not going to repeat right now because they were insulting. You know, I heard shame, blame, desperate, all kinds of things other than the real issues of intersection of race, gender, class, that Black women of the whole rainbow, when I say Black, I don't even use the word African American right now. And so and I began to, I spent this last 17 years trying to figure out why. And that intersection of the gender gap, gender-based violence, pay equity, you know, just the structural systemic issues that women deal with, sometimes being single, you know, persons at home, impact that. What I want to say is that HIV has a long history of organizing in marginalized community, and we've created a system of care that can be used by others to this day and has worked. It hasn't ended the epidemic, but it has allowed for care for folks living with HIV. And those are, some of those lessons can be learned for COVID-19. I don't see a lot of them yet, but I think they could. I think one of the things I see in our communities, and even though we have a lot of activists and there's LGBT and there's HIV activists, is that there's rarely an acknowledgement of what it takes for Black folks to show up living with HIV in these spaces. These movement spaces have not yet decentered whiteness. There's an added work that's required for Black folks to show up and talk about HIV as an issue that is like equal amongst us all. We talk about stigma, and we rarely talk about the ways in which it is different. It is experienced differently for different communities by my trans sisters, by my Black sisters, by my Black gay men. It is not one size fits all. Black and brown folks are most impacted, and the reason why we're impacted differently is rarely discussed. And some of the issues that are being talked about now about the racism, which is not new, is just new on the front of what we see. Those racial disparities, those health disparities have long existed and are the real reason behind what we see of Black folks representing 12 to 13% of the population, but yet almost half of the people living with HIV. HIV is a racial justice issue, period. If you know me, you done heard me say this 100 times, because you cannot say that illness that impacts Black and brown folks that has no racial component, that is all about shaming, blaming, and our behavior. It is so much more than that. I've been on the Ryan White Planning Council. I've been in a lot of other spaces, and the only time I hear race discussed is when we're talking about the data. And I always feel like I have a target on my back. We talk about the data and who has HIV, but when we talk about solutions and what we do, we talk about topical stuff. You define care, you define PrEP, you define this, versus really looking at the cultural and the kinds of access to culturally competent care that folks need to really be living healthy and thriving. With the current uprising, it's really given me an opportunity to not only talk about HIV, but talk about some of the issues I've been studying for years around racial justice, in which HIV is but one. HIV is a symptom of broader problems. It is like the leaf. The roots are racism, discrimination, homophobia, transphobia, poverty, which is one of the greater predictors of HIV. So with the uprisings, we've had a lot of time to talk about this, but I don't want these issues around health disparity discussions to go away when we look at who's dying the most and getting the most sick from COVID, because we're the essential workers or so many of those other reasons that I just talked about. We spend a lot of emotional time and energy working with our fellow activists, non-Black fellow activists, and with few exceptions, we avoid any racially related conversations. I really don't understand that. We do not. I think decentralizing white folks would require a real shift in power to ensure that power and authority is distributed equitably among non-white folks and those most impacted. And when you look at who primarily runs these organizations, and I live in the South, they do not look like me. I don't see accountability to me. I have nothing against the folks that are out there doing the work, the hard work, and they've been doing it for years, but I have to ask the question, why? And I believe that the reason is because power is a hard thing to relinquish. It is counterintuitive to work against your own self-interest or appearing own self-interest, because I think Black women rise, all boats rise. And so I don't think that's necessarily the case. As Frederick Douglass says, power concedes nothing without a demand. And I think we have to demand different. One of the things that I'm most proud of is I've been part of a group called Black South Rising and another one called HIV Racial Justice Now, that is really looking at how can we infuse a racial justice framework into this HIV discussion as well as the COVID-19 discussion. And if we do not, funders can look to do this differently. And if we don't, we're going to be continuing to do the same thing over and over and over. Black South Rising is really looking at the way that we in the South look at how do we support HIV leaders in the South and doing things differently and being accountable to others. I know that I'm new to HIV movement, only 6 years into this, 17 years living with this. And I've been working in urban communities for over 30 years. 40 years into this epidemic mandates a change, and I think racial justice, and I consider racial injustice as a key driver of the epidemic. I see it in COVID and I see it in HIV and MIPA, and if you don't know what that is, that means the meaningful involvement of people living with HIV or AIDS, and I'm gonna also say the meaningful involvement of those most impacted need to be involved in the design, the plan, the implementation of all programs, services, and decision-making and funding that impacts us. And until we do that, I don't see the change. We cannot tolerate being relegated to the sandbox, to tokenism, to holding meetings that are not accessible to the community. Calling it a public meeting or community meeting doesn't make it one. Asking me for my advice and doing nothing with it does not help me. So I say again, HIV is a racial justice issue. We can't see an end to the HIV epidemic, nor to what I'm beginning to see around COVID and the policing and the criminalization and the blaming and shaming without dealing with the root causes and the structural and systemic issues that I talked about before. Solutions must deal with the root causes. in order for us to change. And racial justice, I think, is the framework that we need to be looking at. Decision making, most impacted, the hiring. We must be looking at who is doing the work, who's designing the work, and who's being funded to do the work in order for things to change. And decentralizing whiteness does not mean we don't need the work, the help of our white fellow activists, but it does mean that we might need to change places on this boat. And so I thank you guys for allowing me to speak.
Thank you, Vanita. We are off to such a powerful start already. So thank you for what you shared with us. And especially when you talked about the meaningful involvement of those most affected. And it really is not just the meaningful involvement, but I also talk about the mindful involvement of all affected. So it carries throughout all of the discussions, all of the work, and that's something that we in this work need to make sure it is happening. So thank you for that. I want to remind everyone that we do have a Q&A feature, so please enter any questions you may have as we're going along. We'll be sure to address those at the end of this session. And next on the roster, we will be hearing from Araya Lester. Araya, welcome.
Hi, hello everyone, and hello everyone watching and attending. Vanita, you gave a word. You gave a word and you set the tone for us. I'm Araya Lester. I'm the Deputy Director of the Transgender Strategy Center. But more importantly, I'm here representing my most specific intersectionalities. I am a person living with HIV, as well as being a Black woman of trans experience. And these are all the intersectionalities that I'm bringing to the table. And when it comes to HIV, when it comes to racial justice, when it comes to, as a Black woman of trans experience, what I find is that my womanhood is both not respected and weaponized. So when it comes from it being not respected, is me exuding and living in my womanhood as a woman, and as a Black woman even more specifically, denies me access to so many things, so many things. You know, I'm deputy director now. I was homeless, you know, not a few years ago. And this was while I still was living with HIV. As a matter of fact, when I acquired HIV, I was homeless, and I was in a situation that actually got me sexually assaulted, that resulted in myself living with HIV. And at that time, I was already an executive director of starting the first trans organization in Miami-Dade County. You would think that someone that got to the status that I had at that point in time would have had enough resources, enough support, enough programs to help out even myself. But no, you know, I was put into a situation to where something like that was easy to happen to me as a Black trans woman. And when you think of all the other women, Black and brown, you know, that are acquiring services, that have even less resources than me, you know, what do they have? You know, and their womanhood every time is being threatened, it's being used. And then not only is it not respected, but it's also weaponized. You know, as a member of the Black and African American community, like we see the blueprint, right? We see how our government is structured. We see how power is structured within the United States and in many countries around the world, to where, you know, the upper echelon example of power is an older white cisgendered man, heterosexual, right? That's the blueprint. That's the blueprint that has been stamped into the Constitution, that has been increase within our media perception that's been perpetuated, that's been exalted, that's been continued, within the faces of all our little Black and brown children, continuously, be it TV, be it at school, and when we're looking at the authority figures that people see in life, is that white, heterosexual, cisgendered man. And so the direct polar opposite of that, direct polar opposite of white is Black. Direct polar opposite of man is woman. Direct polar opposite of cisgender is transgender. So when you look at someone like me, a Black woman of trans experience, I am the polar opposite of what society has placed to be. This is power. This is privilege. This is where you need to be, where it's easy for you to succeed in life. And so in our Black communities, when you see someone who, like myself, was assigned male at birth and then transitioned to become a woman of trans experience, in a lot of people's kind of subconscious perception, it is that I have taken away that which gave our community power, that masculine, that male portion, and I threw it away. And so therefore I'm throwing my value away. I'm taking away value from my community. So therefore my life has lesser value than what it previously once had. And so one of those privileges that we see taken away is the value of our actual lives as we're walking the streets, as men are, intrigued or interested in us, but then our realness, our transness is something that offends their masculinity, and then you see the high rates of murder, you see the high rates of violence, and then you see it intertwined and intersected throughout everything, to where you see that we're dealing with unemployment, that we have trouble even succeeding in navigating within LGBTQ spaces and organizations, to where we need to demand funding specifically for us. That all those racial intersections, there's no other community where it's more than 50% of our HIV incidence rates, right? But in certain trans communities, you see that. You see it. And so when we're talking about ending the epidemic, if we use the blueprint of ending the epidemic for a Black trans woman like myself, then it'll trickle upwards and it'll work for every other person, because that's that polar opposite of that white man, of where that power lies. And if we address the issues that our Black and brown trans community members, trans men, trans women, gender nonconforming have, we'll have the solution. We'll have what we need in order to help everybody else out. And with that, I'll pass it along to my sisters. Thank you.
Thank you, Araya. We are on a roll here. This is some really powerful information that you're sharing, and looking forward to what Anna and Rania have to add to the conversation. But a couple of things that you mentioned, Araya, as far as value, and I want us to have a conversation about this at the end, as far as what it's going to take to value Black womanhood, just across all of these areas and issues that we're talking about. And understanding that until Black women are valued and are felt that it's important to be protected, where people feel it's important for Black women to be protected, we're going to continue to see some of these things. So those are some of the conversations I want us to have toward the end. Now we're going to turn to Anya. Anna. Welcome, Anna.
Hi, everyone. Thank you so much for inviting me for this panel. I'm so humbled and honored to be here. Araya, Vinita, thank you so much for sharing. It's truly very powerful to hear your words. I decided to make 2 slides just so more visual people can follow. And I also added a Spanish translation in case anyone prefers Spanish. So just a little bit about myself. I work at Southern AIDS Coalition as a health policy associate. I'm originally from Brazil. I was born and raised. I lived in Mexico for almost 6 years of my life, middle school through high school, and I immigrated to the US 8 years ago. I've been working in HIV for only 2 years now, so very recent, but mostly my focus in public health has been with the Latinx and immigrant communities. And prior to coming to Atlanta and working in HIV, I was working in Iowa with agricultural workers around healthcare access. A lot of the people I worked with were undocumented immigrants and trying to provide them with healthcare that they needed. Yeah, so that's a little bit about me and where my passion and where my work lies. So if you can go to the next slide, please. So I think I wanted to talk about the Latinx population, but naturally when we're talking about the Latinx population, we usually talk about immigrants. And I think in the world of HIV, we're seeing so many barriers for Latinx and immigrant communities. I think we underestimate the power of language and how much language barrier affects our quality of care for these populations. And it's something that we don't really talk about, because in the research that I would do at Grady and at Emory University, a lot of the people that the LGBTQ Latinx population in Atlanta, a lot of what they were so frustrated about is that they couldn't connect with a physician to ask for the healthcare that they needed. And that is for HIV and PrEP. And so I think, what can we do, as advocates, because there's a clear, barrier in medicine that they are not accommodating for, Latinx, for immigrants, for trans people. They're not being accommodating and inclusive for all these populations. So who are they really serving? Because this is creating huge health inequalities. A lot of the things that we also don't really think about when talking about the Latinx and immigrant population is that it's so diverse. So our cultural backgrounds affect how we perceive health, how we behave, and that's something that we also don't talk about. There's a lot of low access to healthcare and insurance for the Latinx and immigrant populations. Usually immigrants, especially undocumented immigrants, do not have rights to be on Medicaid, to apply for private insurance, even though they have money to pay for it. So it creates a burden and a huge health inequality. And I mean, immigration status is just a whole nother layer that adds to the lives of these populations, because I think, the United States has created an immigration system that is, run by fear. And immigrants live in constant fear. And that impacts everything in their lives. They're scared to go to work. They're scared to go to the doctor. And it needs to change, right? And we're not, allowing these people to be on the table and advocate for themselves. And I think we need to create better efforts to include Latinx and immigrant populations on the table and actually hear what they need, because it's so easy to just assume what they need, right? Can you go to the next slide, please? And one other thing that I wanted to talk about is, how is COVID impacting the lives of Latinos and immigrants in this country? A lot of the things that I've been hearing is that, well, COVID is bringing to life so many systemic issues in this country. I disagree. I think that, you know, us that we have been working in public health and policy for so long, we have been seeing these issues for decades. But I think COVID is definitely exacerbating the level of damage that our system has. And I think that is very important to keep in mind because these are issues that we've been dealing for a long, long time. I also wanted to touch on, you know, Latinos and immigrants are usually in essential workers. So in agriculture, we see them in meatpacking industries. That's, I mean, the population that I've worked with. And it's really sad, right, during COVID that this population is being so affected, but they have no security, sense of security and help from the government. There is nothing, even though they are so essential to put food on our table, for this economy. And how are we treating them? You know, and I think there's a huge mental health impact about how this country is so anti-immigrant, and I think it, you know, perpetuates I don't know, what I'm trying to say is that I think as an immigrant and you're seeing the disrespect that this country has for our immigrant brothers and sisters, it makes you feel like you're not worth it, even though we are making such bigger things in this country and are so essential for this country. So yeah, that's a lot. I was just went on a rant, but that's kind of what I wanted to bring into attention. I think there's a lot of things that need to be fixed in the system: immigration reform, healthcare, not just for Latinx immigrants, but for trans people, LGBTQ, everyone. And it's very easy to feel so hopeless because at least in the past month, that's how I've been feeling. But at the same time, I do think that, you know, meeting all these amazing people doing the work, all these great, powerful panelists, this is what gives me hope, because I know there's people like us that are doing the work and are uplifting our communities, and this is what we need to make change. So sometimes I do feel hopeless, but then I remember all the people that I work with, and then I gain a little bit of hope. But well, that's all that I have. Thank you so much. And I can answer any questions at the end.
Okay. Thank you, Anna. And like you know, just being part of this panel is what gives me hope. And I thank everyone that has shared so far. And we will hear from Rania in just a moment. But there's a question that came up, Anna, that's specific to what you were discussing and the communities that you're discussing as far as immigrant communities. And the question was, is ADAP accessible to all immigrants who are living with HIV? To address that question?
I am not sure specifically for undocumented immigrants. I am not sure. I can definitely, I will do my research and get back to you. I'm not sure about that answer, but for undocumented immigrants, I'm really not sure.
And we can look into that also. And if anybody has the answer to that, actually, please feel free to put that in the chat or in the Q&A. All right. Thank you again, Anna. And our next speaker is Rania Copeland from the Black AIDS Institute. Welcome, Rania.
Hi, I'm excited to close us out and then hopefully be able to have some amazing conversation. This is a fierce panel of women, and I don't think that's by coincidence. You know, the type of, I think, oppression that we see that is gender-based really kind of fuels, I think, our engagement in this conversation. And so I'm excited to do that. We can go on to the next slide. So like we heard, my name is Rania Copeland. I'm the president and CEO of the Black AIDS Institute. I'm gonna swing through these slides. Our mission is to stop the AIDS epidemic in Black communities. And we do that by engaging Black institutions and Black individuals to confront HIV. You can go to the next slide. We're a team, the BAI team is a community of experts, activists, and advocates who show up in all spaces where Black people need help. We are led by people who represent the issues that we serve. We care about everything that Black people unjustly face in this country. HIV is one piece of that, but you know, as you've heard and we're talking about today, that is intersected with so many other things. And we believe that our work is activism and resistance materialized. Our work is beyond critical, it's urgent. And so I'm excited to be able to speak with folks who are having this conversation and people logging in on a Tuesday evening for some of y'all to discuss this. Can you go to the next slide? A little bit about me. I'm from Southern California, a Southern California native, and my parents are from the East Coast, but they migrated to California when they joined the Nation of Islam. And so they were kind of big time Black Christians, long history of Christianity that really was rooted back to slavery and the Underground Railroad and opening up some of the first Black churches. My parents converted and they were a part of the Nation of Islam. They converted to Orthodox Islam under the kind of guidance and leadership of Malcolm X and other leaders. And so for me, I always grew up with a very, very clear understanding of anti-Blackness and how anti-Blackness really does shape every aspect of Black lives. And this freedom that, you know, Black people were supposed to have had was not real. And that you could look at so many aspects of Black life to show how this oppression was still really kind of stymied in our world. And I don't think personally, there is too many other ways to kind of, there's not too many ways that we see this type of oppression more than HIV. You know, we've had these kind of amazing breakthroughs when it comes to HIV, but it's very clear that the US epidemic is primarily an epidemic that impacts Black Americans and other communities of color. And that these are communities who have the least amount of resources, the least amount of positional authority to actually respond. And for me, that's part of what got me into this work, right? When we see the numbers and the impact of how HIV impacts Black communities, how can we not all be standing up and saying, what kind of injustice is happening here and how do we respond to that? And, you know, what Black AIDS Institute believes, and I think we have data to kind of show, is that when we're talking about HIV, we've had these kind of amazing movements that really we owe huge debts to the LGBTQ community, that there was this huge movement that came from white gay men in the early 80s and 90s that developed some of our first HIV and AIDS service organizations that have gone on to become huge federally qualified health centers. And I think that there was always the idea and the concept that those that were most impacted were going to be leading these efforts for change, right? And that when we saw this epidemic emerge, that the idea of those who were most impacted were leading that charge. But when we look around today at our HIV movement, how much do we have concepts around critical race theory, around anti-Blackness, around racial justice in our movements? And so I'm going to talk a little bit about some theories that I think are really important for how we do our work. So can you go to the next slide? I think that if you know that people are trying to ban information, then it's probably information that we need to know. What was it, last week or recently, that we've seen this new we'll see if it works, but this new kind of idea to try and ban and calling it unpatriotic, this concept, this well-renowned concept of critical race theory, or CRT. Critical race theory was developed in the 80s and 90s from some leading legal scholars, and it really recognized that racism is ingrained in the fabric and society of that it's ingrained in the fabric and system of the American society. That we don't need individual racists anymore. We can see on social media people thinking that they are, they have Black friends and they, like LeBron James or whoever it may be. And so that they are not racist, right? So and critical race theory acknowledges that individual racists don't need to exist because we have institutional racism that is pervasive in the dominant culture. And this analytical lens that critical race theory uses is really examining existing power structures. And critical race theory identifies that these power structures are based on white privilege and white supremacy, which perpetuate the marginalization of people of color. I'd offer that our HIV movement hasn't really entrenched ourselves deeply enough in critical race theory. If we were, we'd be thinking about, and we would have completely different systems for how we run our organizations, how we do our hiring, who sits on our boards, how we determine who gets hired for what, how we determine who gets paid for what. And what we instead are doing is perpetuating systems of patriarchy, right? Perpetuating systems of white oppression. And it's happening from many times well-meaning white LGBTQ folks. It's happening many times from Black people who kind of fought up the ladder to try and get into positions of leadership, but then continue to perpetuate these systems. And, I think when we look around at our movement, when you look at some of the largest HIV and AIDS service organizations in your community, when you look at some of our leading national organizations, and you look at who's on the executive and leadership team, when you look at who's on their board, when you look at who's on their management team, and you look at how long people have been on the front lines without being promoted up or being put through school, we see how this well-intentions mean nothing and actually fuel these systems of oppression. Can we go to the next slide? I just wanted to kind of give y'all a couple more terms that you should Google, that you can read about, that are from people of color, that talk about and give theories and lenses for how we can do work in a way that centers communities that are most impacted. We heard Araya talk about intersectionality, the concept that these different experiences that we have, these different identities that we have, that they come together and they develop a different experience for folks, right? So the experience of a trans Latino woman in Alabama is a different experience than a cis Latino woman in Los Angeles, right? The experience of me as a Black cisgendered 30-something-year-old woman in Southern California is different than even a Black cisgender woman in North Carolina. And that we really have to look at this intersectionality because it impacts how we do our work, it impacts the experience of our clients, and we have to think about this when we're developing programming. We have white privilege, which I think that was in the title of this presentation and this kind of slide set in this panel. And white privilege really is about the notion of social advantages, benefits, and courtesies that come with being a member of the dominant race, essentially white people. And so, you'll hear me talk a lot about white cis men in our work, particularly many of the white gay men that we love that have been doing this work for decades and decades. And how does white privilege show up in that? How does white privilege show up for white women who are doing this work? And I think that we have to be honest with each other as a movement, that white privilege shows up. Otherwise, we wouldn't have leadership that is so heavily white when our epidemic is so disproportionately impacted by Black and brown bodies. There's microaggressions that I think you probably heard, people of color talk about regularly, but this is the notion that we have these sudden or stunning transactions that really kind of mar the everyday experience of oppressed people. These are small acts of racism. This is, you don't speak like a Black person. People don't tell me that, but other people say that to the people. Oh, I can't believe you went to school. All these kind of experiences that really traumatize us as people of color and really continue to lift up these systems of oppression. We have empathetic fallacy, the concept that just because you empathize with us does not mean that you're actually dismantling systems. And so yes, you can feel bad that George Floyd died with a knee on his neck. You can feel bad that nobody indicted the murderers of Breonna Taylor. But if you are not actively trying to dismantle those systems, then you are also part of the problem. Then the last one I'll just talk about is misogynoir, and that's about this specific racism and sexism that Black women experience in this country. So I say this to say, if we aren't talking, if these concepts aren't in people's work plans, if these aren't in your proposals, if these aren't in your values as an organization, then there's no way that you are being, you're being that means you're not being anti-racist. That means that you are holding up systems of oppression. It takes active dismantling to be responsive to this. Next slide. And so the last kind of couple minutes I have is really about kind of how we can use this social transformation, or how we can have social transformation in our work by using a race-conscious approach in our work. Like Vignetta, we love to hear about race, or we hear about race all the time when it comes to the data. We'll hear about, we're doing better now if we get, proposals and grants that are race specific, but that is not a overall race conscious approach, right? And so I think there's 4 things that I would like to offer as it relates to social transformation around ending white supremacy and centering those most impacted in our efforts to end HIV. My next slide. So earlier this year, yeah, y'all know it's been the longest year ever. But the Black AIDS Institute worked with so many amazing Black folks across the country to develop a plan to end HIV for Black America. That, we had this current president develop a strategy to end HIV in the next 10 years with the largest infusion of new domestic funds for HIV in a long time. Though the funding and the expense and the money that we now see around the ending the HIV epidemic effort is exciting, it's needed, it's what we've been requesting for a long time. The strategy itself didn't really speak to how to do that, right? It was very much a biomedical effort, get people on PrEP, try and do cluster surveillance, these kind of other really kind of biomedical solutions. But we know that the problem around ending HIV is not just biomedical, it's about these systems of oppression. And so we were able to meet with many folks across the country, do town halls. We had an amazing advisory group that really kind of gave us some key recommendations around how to really end HIV in the US. And so I wanna end with these 4 recommendations. The first is that we have to dismantle anti-Black practices, systems, and institutions that endanger the health and well-being of Black people and undermine an effective, equitable response to HIV in Black America. Oh, wait, I think I pressed the button. Can you guys hear me? Yes, okay, I'm sorry, yes. This is about this dismantling, right? That we can't continue kind of on as we continue to do. Recommendations we have in this is, how are we developing and effectively resourcing local and national anti-racism and social justice coalitions that situate HIV within a broader context of human rights? That, you can't be responding to HIV in Kentucky, you can't be responding to HIV in Minnesota, you can't be responding to HIV anywhere in the US, particularly for communities of color, without also including in your programming and your efforts how you're responding to anti-racism within your local cities, within your local communities, and across the country. I'd also add, that we really have to think about how, especially right now, how do we mobilize Black communities, allies, and elected officials to reform laws and policies that impede the fight against HIV in Black America? That means ending HIV criminalization. That means enacting laws that recognize the diversity of gender identity, that prohibits discrimination based on sexual orientation, and implement gender-affirming policies and procedures. There's lots of things that I think are related to structures and systems that have to be responded to. How do we respond to reforming the criminal justice system? When we look at HIV and the impact that it has on people who've been incarcerated and people that are currently incarcerated, there's no doubt that prison reform the criminal justice reform has to happen as well. The second recommendation is really about providing resources and services that address the fullness, the richness, potential, and expertise of Black people, and really mitigates social and structural factors that worsen health outcomes in Black communities. This is making sure that our programs really are comprehensive, they're holistic, and they effectively address the lived realities of Black people and meets the needs and the preferences of those communities. This is talking about housing. This is thinking about how we really integrate harm reduction in a uniquely and unapologetically Black way with our services. Lots of stuff around that. The third pillar is ultimately healthcare is a human right, especially for Black folks in this country, especially for poor people in this country. That healthcare should not be for something that is for people that have money, people that are employed in a way that the US system acknowledges employment, but that really healthcare should be a human right. And we've seen expansion of healthcare with the Affordable Care Act, but we know that the Affordable Care Act, which is already on its last leg, may be completely dismantled with the next nomination for the Supreme Court. But ensuring that we have high quality health care, particularly that is culturally affirming and gender affirming, is critically important. And then the last thing that I will end on is this is something that I personally feel so passionate about. It's really about building the capacity and motivation of Black communities to be the change agents for ending HIV. There's no way that almost 4 decades into an epidemic that we have such little HIV leadership within the Black community, that we have amazing HIV organizations that are leading the work. We have some amazing organizations like AIDS United that I think has really kind of transformed their racial justice work. And we have amazing leaders like Valerie and Jesse who are leading the organization. But when we look at some of our HIV organizations that are Black and Brown led compared to their counterparts in the city, the LGBTQ HIV organizations in the city, we see a dramatic difference in the organization's budget, their reach, and their capacity. And that to me is nothing short of an obvious experience of oppression and of how systems of oppression fuel our work even now. And so ensuring that we can generate broad and enthusiastic ownership in Black communities to fight HIV, that Black folks and Black communities are willing to take on that leadership, but there has to be investment in our communities to be able to participate, to ensure that there's sufficient financial resources to enable Black communities to lead. We have to make sure that local ending the HIV epidemic efforts are responsive to the needs and circumstances and preferences of Black communities, and that we really are supporting Black people in the HIV workforce through training, capacity building, through professional development, so that we can ensure their success and be the next leaders who really are taking us to the end of HIV. All right, I'm gonna stop there. Thank y'all for letting me be on this panel. These are one of the things that I love talking. Oh, I see. Shout out to Black Treatment Advocate Network's BTM folks on the call. There's many people here I know that were a part of developing our Black plan to end HIV. Yes, and I'm just gonna stop so we can hear questions and hopefully have conversation.
All right, thank you, Rania. And even though you ended your presentation there, we're not ending the conversation there. So, but thank you for that. And thank you to Anna and Araya and Vanita for your presentations also. And now we're really going to get into the heart of the discussion. And I want to make sure that, again, we remind everyone to put any questions or comments you have in the Q&A or in the chat, and we'll try to get to as many of those as possible. But one of the things that I wanted to start off with, and it's in our title for this session, which is Decentralizing Whiteness, which is part of the title. But one of the things we haven't really touched on is, what are we really talking about when we say and use the term decentralizing whiteness? What does that look like? And this is for any of the women on the panel.
Well, I can start in saying that, you know, HIV, it hasn't really been a problem for white people in a long time. That's what we see. That's what the data shows. Look at Ryan White. You know, it's a program that was built off of the lived life experience of, you know, a little white boy, right? And so when Rania talked about that history, when you look at like who was involved in writing the different principles, you know, when you look at that, all that structural stuff, like what the easeability, like how easy was it to put something together? It was easier for white people, you know, than it was for any other person. And so therefore the structures that we even see within HIV, that we even see within, you know, we see all these affected populations, but most of the power is being held by white people. You know, it's being held by organizations where the CEO or executive director is a white person. They have a couple of token, you know, Black people on their board. They may have, you know, one or two in upper management, and then they have a trans person as like a peer navigator or something. And, you know, and that's what we need to look at, how the diversity tables are not holistically within the organization. We need to be looking at it specifically for high management, specifically for people who are decision makers, who are at the table and in the meeting before it comes out to like, okay, let's get the buy-in from the community, or let's get the buy-in from this group or that group or your advisory group, who are in the back room that actually puts everything together and then gets the recommendations or, you know, or whatnot from the rest of the group. So I think that that's what we have to look at when we look at the structures and how things are with HIV within our current climate.
And I so agree with you, and I think I want to add a couple things to that. First of all, in the decentering whiteness will first be also require bringing forth the full history of Black folks' involvement in the AIDS movement. If you look at the movies, you look at the things, it don't look like no Black folks ever had AIDS in the early 80s or something. And you don't see a lot about Katrina Haslip, you know, because in the beginning, you know, the saying was, women didn't get AIDS, we just died from it. And here was a sister in New York who fought and didn't get the benefit of it because died from it, but because of her, the kinds of illnesses, AIDS-related complexes that women get now reach the definition of AIDS, and so that we were able to be classified and included in that. And so that's not the kind of history, that's not the kind of things that are being talked about. So to me, that history needs to be talked about. And then Araya talked a lot about those key decision makers. And, you know, I remember working for FQHC. And if I said HIV is a racial justice issue one time, I said it 1,000. And I had to keep explaining, even though the people we look like me and we never went beyond to think, what does that mean? Because white people were making the decision, and white people were assuming and stereotyping who we were and why we were there. And so decentering whiteness means, in that respect, that we need to be asking others, we need to be talking, we need to be the decision makers, you know, about what is really going on and why is. And I always say this, I have this white kid, 17, over here in this affluent neighborhood, this Black kid over here in a neighborhood isn't affluent. They're doing the same behavior, same thing, they're experimenting. This kid gets it and the society says, see, you knew better. He doesn't over here, and it looks like they did something different, and they did nothing different. when you look at how Black women are still viewed, you know, I believe if this disease impacted white women to the degree that it impacted Black women, society would feel a need to protect, and we don't protect our Black women. We still are operating off of these 4 stereotypes of the mammy, the matriarch, the hypersexual, and I'm forgetting my 4th one because I have the Jezebel,
yeah.
the mammy, the matriarch, and the welfare mama. And you know, when welfare was first invented, it was for white widows because we saw value in women staying home to take care of their kids. It didn't become a lazy welfare queen idea till Black women needed to stay home and take care of their kids or begin to access it. So there's a whole shift around why whiteness needs to be descended from our children, to the need to protect our Black women, to the need to make decisions, and the need to stop making assumptions about who we are and how we got here.
I'd say that, I love talking with y'all. I think, you know, decentering whiteness means that we are gonna center communities of color at every point. And I think that as a movement, we have done better with centering communities most impacted in the work, theoretically, right? When you look at funding announcements, when you look at funding streams, that for the most part, it's, you know, this is for Black MSM, this is for Black trans women, this is for, you know, whatever kind of programming that happens. And I think the false kind of notions of centering community then started from advisory groups. And, you know, this idea that, okay, so, you know, we're not gonna actually, you know, we're gonna continue to center whiteness within power and leadership. And instead of trying to center community here and people most impacted within that level, with the actual levels of power, we're going to develop a 14-person advisory group or whatever it is, and at least 20% got to be living with HIV or whatever, you know, each kind of whatever the Ryan White Planning Council guidance is. That became you know, I think one of the areas that we institutionalize sidestepping centering communities of color because we were so unable to see what kind of really centering communities most impacted means. But I think that, you know, HIV does it at a very superficial level. We do it at the person who is impacted by HIV, but we don't do it more throughout. And so to me, decentering whiteness is assuming that Black, brown, and trans people are supposed to be leading organizations. They're supposed to be sitting on boards. I saw a comment, they're supposed to be in health departments. I mean, we see that all the time. They're supposed to be in health departments. You know, I would also say that means that's supposed to be in elected officials, because many times within health departments, state health departments, that there's a relationship with people who are elected. And so I think decentering whiteness, especially in this conversation, we're talking about positions of power, and we're talking about positions that can create change, and that decentering it means that we're going to start holding folks accountable. That means that we're going to organize as people of color, organize as LGBTQ people of color to start holding people accountable, especially now, especially in this movement, especially as we see increased resources going to these jurisdictions to do ending the HIV epidemic work, that we, and I think we all should really be holding organizations, institutions, and health departments accountable.
Did you have anything to add?
Yes, I think I'm more into the research perspective of things, and I think research, academia in general, is something that really needs to change. My years working with research in HIV, at maybe I shouldn't name names, but it was majority.
No.
Well,
No,
I was working at Emory, a lot of people know, but I mean, big researchers that research is used for a lot of the HIV interventions and decision-making are done by white, cis, straight men. And are they in the communities? No, they're not, because community work is too hard. Community work takes too much time. But that's, you have to do that. That's why I advocate so much for community based research, because it's the community that is coming and seeing, hey, this is the problem that we as a community identify. Please give me some of your resources so we can do the research, so we can, you know, come up with what's wrong. And I think that is the problem with academia and all the research that's coming, research that's being done for HIV, is that it's coming, don't want to say from the wrong people, but it's not from the community. And I think that needs to change.
Yeah, I'm glad you touched on the research side of this, Anna, especially when we're looking at not just, you know, medical research, but also as far as interventions and other types of efforts that are put into practice in communities of color. And, you know, there's a saying that was coined by some Black feminists back in the early 90s, all women are white and all Blacks are men. And when you think about that, that gives you an idea of, you know, what researchers focus on and who they focus on when it comes to, you know, developing initiatives and other things for communities of color, and especially when it comes to representation of women of color and Black women especially. But one of the things that I saw pop up in the chat a couple times was, you know, a reference to, again, speaking to what you were talking about, communities of color being hard to reach or hard to get at. And anybody that's heard me talk about this before knows that I always say it's not hard to reach, it's that they're hardly reached. And there has to be more of an effort to do that. And that's part of that decentralizing whiteness that we need to focus on too. And one of the things also, and I'm going to the chat because there's some interesting things in the chat. One of the things I saw also as the discussion around decentralizing whiteness came up, and what you were talking about, Rania, as far as the importance of, you know, there has to be this coming together on all fronts in order to make this happen. But there have been a couple references about what's the perceived infighting that takes place in Black and brown communities, but especially in Black communities. And the perception that, you know, we just can't get along kind of thing. And I want to be able to address that directly because I think it's a bunch of bull. But how do we address that kind of sentiment that's out there that we will never be successful in this because we can't come together around this?
Yeah, I think I tried to chat a little something, but my fingers were moving and then I was trying to be here. There's a lot of good stuff happening. There's a couple things I'd say to that. One, I think that it's a perception. These white folks with some money, they fight real hard. And I think that this concept that it's only Black and brown folks and that we're crabs in a barrel, I think it's a bit more about human nature in some aspects, that the kind of infighting that can happen, some of the nastiness, I think happens across all races, I would say. I'd also offer up that Black and brown communities, trans communities usually have the least amount to work with as well. And so, you know, if you have 5 different organizations in a city that are trying to do work, but they're only given, you know, $20,000 that they all have to fight for to try and get it, you know, I think taking a step back and questioning, well, why in the hell are we only getting $20,000 to do this work, right? When we know that in most places, Black people make up almost half of new HIV cases. And I think that most of the times when I've seen some of the infighting, it's more so about a lack of resources that have been properly given to a community, and they're kind of scrapping for things. And it's not as much about, you know, us not wanting to work together. It's really about, you know, a lack of resources coming. I mean, there's some really great examples that I've seen. You know, I know that Chicago has a lot of things going on, that there's some coalition work happening amongst Black organizations and Black leaders that have really been working with and really kind of lobbying with and maybe not lobbying, but really pushing and demanding from their health department to do better with how they fund Black organizations and Black work, and how that kind of supports Black institutions. And so I would say that it's really more so about how we're not given resources to do the work that we know is critically important.
And, I want to add to that, I was part of the HIV Racial Justice Group that wrote a Declaration of Liberation. And one of the things we talked about is this idea, and I think it's perpetuated by white supremacy culture, that there is a lack of resources. And so, and there is an intent to pit us against each other over this lack of resources. I remember hearing about in the 2018 election, there might have been 80 billion or some crazy ass number that was given, and I only use that to say that I don't necessarily see the lack of resources. I believe that's an idea perpetuated, and so that we're pitted against each other, fighting over nickels and dimes, when working together there's more. But I believe that's a part of the white supremacy culture that perpetuates that kind of idea, when that is not really the case, nor do we have to do that. And I look for the day when we're working together and going and saying, either fund us all or we ain't going for it.
And it's not even an idea. What it is a myth and a lie. And the way that they've created this myth and lie is, look at pharmaceuticals. Pharmaceuticals, they're multi-billion-dollar. Where do they get their money off of? Off the bodies of Black and brown people. When you look at the big donors to big foundations and other philanthropic organizations, where do they get rich off of? They get rich off Black and brown bodies. They get rich off the little purchases that we make. That in essence, it is our money. And then this money is then used and then said that, okay, we got this money off of Black and brown people, but now we're going to say that only this amount of chunk can be given back, only this amount. And so then you have organizations and communities and intersectionalities all fighting amongst that amount that they actually created. Like, we created what is there, we created what is available, and what it is taking back our powers, almost like the reclaiming of what we know that we have put into the world's economy. If you take away Black and brown people's spending habits, the whole economy goes down. And so what we really need to look at is how this is intertwined within the, and then, like you said, Anna, and then at the other end, you only have the white people doing the research, and then, what do they base the funding dollars off of? They base it off of what those research numbers are. So if there's not Black and brown people doing the research, then they're not collecting the right Black and brown numbers, and therefore not saying that the Black and brown people deserve this, because look, and so, yeah, I think that this could be a whole other session, Valerie. I'm gonna stop there, because
it is a whole other discussion. Absolutely. Anna, did you have anything to add?
Just one small thing from what Rania was saying about funding and how little, our CBOs working with HIV, especially focusing on communities of color. Since coming into Southern AIDS Coalition, what I noticed is that a lot of funding is basically our partners, all of our partners, that we're working for the same thing. We are competing for the same grants. And I think, why is there a need to create competition between organizations that are fighting for the same thing? It shouldn't be creating competition. Every organization should get their designated funding that they need. And so I think it's so sad that it creates this competition and divides us all. So that's just one thing that I've noticed working, and yeah, it's really sad, but that's just the comment I wanted to add.
And speaking of dividing, one of the most recent things that's going to be a divisive wedge is this executive order that I don't even need to go any further with it. But, you know, if this is something that actually comes into practice, how have each of you given thought to how you're going to address that within your work? Because we can't talk about this work, we can't talk about the importance of all of this, and we can't talk about white supremacy and dismantling white supremacy and decentralizing whiteness without talking about it. So what thought have any of you given to how this is going to affect possibly your work?
Yeah, I think I saw something in the comments around coalitions together and banding together and refusing funding. I mean, I don't know how we can end the HIV epidemic, which is hundreds of $millions a year that this current administration is pouring into jurisdictions to end HIV in 10 years, without being able to talk about something as simple as critical race theory. As I would say basic as critical race theory, this concept, I think it's also gender or race stereotyping. I'm more concerned about it on a federal level and a state level. How can our capacity building assistance providers be able to do work related to trauma-informed care, which is a part of, which is a concept that's underneath the umbrella of critical race theory and intersectionality? How can you talk about trauma-informed care without being able to talk about race, not even just talk about race, but really to talk about kind of the trueness and the history of this country? And so, I don't have any solutions completely yet. Beyond more than, I think that it's going to probably take us kind of really coming together. I do hope that this has in some ways kind of enlightened some folks into how important these theories are, and how they can potentially kind of change our work so dramatically, right? If you look at the past few years, I think one of the amazing things that the Black Lives Matter movement has done is be able to really shine a light on some of these concepts that before, I would say, at least in my experience, were things that I learned from school, right? From my degree in African American studies, and really making this a part of the kind of general curriculum and general part of our cultural norms. And so, I guess what I'd offer is there's no way to end HIV unless we can talk about these concepts. There's no way that we can develop programming specific to populations without also talking about the kind of root causes why populations are most impacted, and taking those root challenges and having them be a part of the solution. And I think that if there was ever a moment for us to come onto the same page as an HIV movement, right? Let's be all on the same page. The critical race theory is an important part of our work. And even if it hasn't always been, moving forward, we can promise and commit that it will be a foundation for our work. And how do we say as a movement, there's no way you are going to entangle us into thinking that we can actually move community and HIV without these critical pieces, these critical concepts that are the foundational pieces of kind of our Blackness and our experience in this country, and really our history and our scholars who've developed these concepts to explain our experience and also drive solutions for the experiences and the oppressions that we've had.
Yeah, it's so recent that I don't think many of us have really had the chance to think about really how this is going to impact our work, or how it could. But yeah, just wanted to see if there were any other initial thoughts when you first learned that this came out, regarding the work.
When I first heard it, and I would ditto everything Rania said, it confirmed to me and how, America was built on racist principles and continues to be. And we're still facing in 2020 the election of someone who still perpetuates these ideas. And what that says to me and my grandson and my people, it says there's still, that we're still not significant. And I have, the words that came to mind to me was like civil disobedience and try me. Because if we're talking about racial justice and knowing that we need to have those conversations in order to really end this epidemic, to pretend that you want to do it and not have that conversation is just bull. And it just, I haven't totally thought through how to do it, other than we're creating some kind of curriculum so that we can educate people about what this means. But it further tells me that an announcement on the State of the Union was a fake announcement, and it wasn't and to follow it up with things of against our trans sisters, and we can't join the military, and now we can't even talk about race because systemic racism really doesn't exist, right? As long as you're in power. So I haven't figured out the way around it, but as you can see, it stirred up a lot because it just confirms for me, and I've been really waiting to see, is white society gonna say no to this? And I haven't been convinced of that yet. Not when I still see 95% support, you know, like this. And it's really downheartening. Sometimes I think I gotta leave, but I can't leave. I got people to help. I got work to do. So I ain't thought of the all, but I really say you can't have a real solution to this issue and not talk about it. So to me, to pretend you got a plan, whether you put money to it or not, is to pretend that it doesn't exist and you never get at the solution.
And I think not figuring it out, Vanita, is exactly where we all should be at. You know, it should be a continuous process. I know that ourselves as an organization, it is a process, you know, and one, I'm myself am a living example of our process, and being a Black woman of trans experience in a position of power with, you know, the highest of decision-making skills for our decision-making power that is within our organization. But then at the same time, like, how is it integrated like within our policies and procedures? How do we put our competitive rates that we pay all our consultants on? You know, we make sure that we're above 75% Black and Brown led in every aspect, from leadership all the way down to our faculty and consultants. We having different things that take into accountants, like the live life experiences of how hard it is to be Black, Brown, and trans. You know, we have an organizational safe word if people are just going through something and they need, you know, a bit of assistance in finishing out a project or a little more time, but instead of going into it and getting into your business, just understanding and having a safe word, making sure that we bring a wrecking ball. I bring a wrecking ball with me in every room that I go into, you know, ready to just break down whatever and just be real about where I'm at and how I got here, you know, and utilizing my privilege that I have now in a position that I have, but then also not being ashamed of my story and what I lived through and what I've been through in order to get here, you know, and then making sure that I take care of myself and that my staff, faculty, and consultants are fully educated on what harm reduction means for you, not just for your clients and for, you know, the people that come in, but what does it mean for you? What does it mean for your work schedule? What does it mean for, you know, the way that you're navigating yourself as a leader, as an advocate, or as an activist, and you know, and making sure that you throttle that passion to make sure that we stay in this all together, and, you know, and stay connected and stay empowered and be at our best. And like I said, just for it to be a continuous process, because it's been centuries that, you know, we've been working on dismantling it, and it's not going to, you know, it's not going to be a solution right away. We just got to do what works and continuously look for what else that we can use to take down that wall brick by brick.
Yeah, right. I agree. I think these are, you know, trying times, and I feel like we need to not burn ourselves out because it's happening. This year has been a lot, and I think we definitely need to, you know, rely on each other, take care of ourselves. And one thing that my boss always says, take care of yourself. The work is going to be there, but you need to be strong to do that work. So take that time and like focus on your mental health, on yourself, and wake up tomorrow stronger and, you know, keep doing the work. And I think that's very important to remember.
Thank you for that. So in the 8 minutes or so that we have left, I wanted to circle back to the conversation around intersectionality, I should say intersectionalities, because we really only talked about using the racial justice lens as we address the issues of COVID and HIV and racial inequity. But there's so many other intersectionalities that we haven't even had the chance to touch on. And again, that's probably a whole other conversation. But social justice, gender justice, economic, reproductive justice, environmental justice, all of these things, all of these lenses, all of these frameworks have direct impact on our communities, our Black and Brown communities. So as we look at, continuing to address COVID-19 and HIV and racial inequities, how are we going to begin looking at it from all these other lenses as well? What are some of the strategies we can use to make sure that we're examining these issues from all standpoints and that we're really taking all of these into consideration?
Just have the right people there. I think if you have the right people there, if you have the right people on your board, you have the right people in your management, then you don't have to worry about having all the lenses taken care of, because if you have the representation as to who you're servicing, and if you have that same representation, throughout, then everything else will work out. You'll know how to, if you have someone who is formerly homeless, someone who dealt with unemployment, someone who's a domestic violence survivor, someone who's an immigrant, someone who English is a second language, someone who's dealing with disabilities, someone who's trans, if you have all of that within all of those sections of your organization, you don't really have to worry about covering all the lenses, because they will make sure that it's covered for you. People will ensure that who their peers are and who they represent is taken care of, in whatever way that they can with the privileges that they have in that position within that organization. That's what I would put up.
Yeah, I mean, definitely, I think, the concept of being the communities that you serve helps with that. A huge amount, especially, like Ari was saying, that it's really kind of everywhere, right? We're not just talking about frontline staff, we're talking about positions of power. I'd also offer, I think cultural humility is an important framework for intersectionality. And the framework of cultural humility is that it's an ongoing process. And, it doesn't mean that all of a sudden, okay, you work with Black people for 5 years, you're the expert. You're done. You got Black people a part of your portfolio for the next 10 years. It's not that, right? And also cultural humility also means that, just because you're a part of a culture doesn't mean that you have insight into every aspect, right? I would never argue, I have the privilege of being in this, or I used to have the privilege of being in the South a lot. And it's very clear that though I'm Black, that experience doesn't translate always, right? And so there's a humility, even as a Black woman, as a Black mother, that I enter every space into, because I'm very clear that our experiences might be different. And so I think a framework or the experience of kind of having cultural humility as a value that enters every space is really important. And that within cultural humility, something that I think is important is how you continuously engage community. So even if you got an all Black board, we got a all Black staff, that we're still, engaging community and really kind of openly asking them for their guidance, for their feedback, their recommendations, that they're letting us know, hey, you're missing the mark here, and also regularly assessing data to understand kind of what are the people that we are committed to serving, committed to empowering, what are they experiencing as well. And so I think that data is an important part of that as well.
And, I would like to say, I agree with everything that's said, but I also think really listening to the folks who are serving and educating them. The concept of intersectionality didn't appear to me till somebody told me what Kimberly Crenshaw. I've been showing up as a Black woman, and I've been showing up, grew up poor and all this. I didn't know what all that meant. So, or reproductive justice. And so for us being a membership organization of women and trans folks living with HIV is first teaching them who they are so that when they are in a room, we can represent those intersections and let people know what they mean and how we need to respond to those intersections. And then in the way that we do the work, you know, whether it be, if I'm writing a grant, I'm never going to write a grant that I'm not going to find a way to get some money down to the person who is out there doing the work, the member, so that economic justice, Zoom, and you know, we have a client who now has to homeschool. Her internet didn't work, so a Black woman dealing with a single parent, so a stipend to up her internet so that she can homeschool her son. So first of all, I think it's just asking our people, recognizing who they are, teaching them what these intersections mean and that they are okay, because for years they were just sources of shame. Be poor, Black, from the South. They are not. They mean something now, and they need to be responded to in ways that it helps us to show our folks, but also to listen to our folks about. So I think it's the way we do the work as well.
Benita, I completely agree. I think, you know, empowering our communities is so important. Another thing that I'm talking about, I was talking this week at work, is, you know, there's a lot of bridges that are not connecting in our work, like community work with policy. It's there, you know, we need to empower our community to be able to do policy work, because that would be amazing. And, you know, and when you see that happening, it's so powerful. So we need to create these opportunities for our community, because that's when we're going to do change. And I think it's so important. And it's something that, you know, I work for. Another thing, Araya and Rania, you guys both said it too, it's creating representation everywhere that we work, because I think it creates so much trust for the community as well, to be like, wow, there's people like me, you know, doing the work. And I think that is so important. And for someone like me, I don't know, I'm always thinking, how can I be a better ally every day? How can I work and build that to be the better person for all communities? And I think that is something that I work and I thrive for every day. And we need to teach people how to do that, because like Rania said, people think that because they took a class that they can represent a whole community. And it's like, no, honey, you're not part of them. So you need to, you know, educate yourself every single day, and you learn more every single day. And I think that's so important for people to learn.
I want to thank all four of you. We have talked about things today that we've really only just begun the conversations around. I think we've mentioned a couple of times, this could be a whole other day's worth of conversations on several of these issues, but I just want to say that I feel very privileged to have been the moderator for this session and had the chance to hear from each of you. So thank you, Vanita and Araya and Rania and Anna, for what you shared today. It's information that we're all struggling with. It's challenges that we're all trying to address, whether at the national level or at our community levels. And so again, this is just the beginning of the conversation. So I hope we'll find ways to continue these discussions, you know, in our workplace, you know, in our networks and other places. And, you know, who knows, we may be able to come up with some other opportunities at AIDS United to have these conversations. I'm putting it out there. So thank you again, and appreciate each and every one of you.
Thank you too.
And want to thank the participation from the audience too. We had a lot of great things in the questions and in the chat.
And I want to say thank you too, Valerie, because nobody, I don't know, and I don't even know your full story of all you do and the work that you have put into this, and the champion you have been for years. I hear about you. So, and I'm privileged.
I'm an old woman, that's why.
Well, I probably am older than you, but you have done some things that I can only dream of. So I want to give props to you, because without you, I don't think a lot of what we're doing would be taking place.
For
Thank
sure.
you. I appreciate that.
Yes. Thank
Thank
you.
you.
And thank you everyone for the kind comments.
Araya, Rania, Anna.
Thank you guys. This is
Thank you so
awesome.
much. It was
Thank you
such
all.
a pleasure being here. Thank you for the interpreters as well.
Yes, thank you.
Thank you.
ESL in Espanol.
And I am going to turn it over to Jesse Mylan, our President and CEO, to close us out.
Thank you. Thank you so much, Valerie. And thank you to that last wonderful panel and all the panelists that we've had today. You know, what I love about AIDSWatch is that it gives us an opportunity to literally come together to listen and to learn from each other and to shape our advocacy based on our oneness, our diversity, our unity, and our understanding about how much we need, how much we want, and how much we embrace living this life that requires so much work, so much hard work, but requires our advocacy to make the system better for us. And this AIDSWatch, which has come together in just 6 months to help us address the moment in which we live, where COVID-19 is impacting all of us, and the call for racial justice is because of all of us. And that work has been so beautifully amplified today and amplified by these two panels. Our first panel told us about the importance of understanding science and the data of this epidemic, this pandemic. It told us about how important it is for understanding the syndemic issues, both our risk for COVID-19 and the risk that we have because of COVID-19, including our greater risk for depression, suicide, and even overdose. And we learned about the importance of continuing to focus on our advocacy for programs and policies and appropriations, whether it's for increased harm reduction policies and access to SSPs, appropriations needed for ending the epidemic, and change needed for basic human rights, for our civil rights to be protected. And our second panel, addressing racial injustice, the call for racial justice and decentralizing whiteness. It brought a powerful panel of women of color, and we heard their stories, their truth, but we also heard their pain and their hope. We heard about their call for changing the power structures, that we understand the power of both cisgendered women of color and transgender women of color. And boy, did we get some new theoretical frameworks, critical thinking about racial justice, how we decentralize whiteness, how we focus on the problem of anti-Blackness, and how we start to dismantle the ingrained structures of racism in our communities. Boy, have these two panels today got us off to a great start for this special edition of AIDSWatch. Now, in just a couple hours, we're going to go watch another important session, and that's a debate where we will hear from the two people who may very well lead us to ending this epidemic. Listen critically, and that's a great transition for us for all we're going to talk about in AIDSWatch tomorrow. We're going to talk about the importance of our advocacy and our vote, and our final panel will talk about how our movement is changing and how it might change because of all that's happened this year. So please join us tomorrow. AIDSWatch is an important part of all of our efforts to build a unity, we need to understand our issues from all different perspectives and to go forward to get the policies we need. Have a great rest tonight. Enjoy the social time together, both online and offline, and we'll see you tomorrow for the rest of this special edition of AIDSWatch, The Road to Resiliency. Thank you all. Have a great night.